Don't forget to subscribe to our YouTube channel. Thank you for watching this video.
Good afternoon, viewers. Today for this session of Beautiful Spotless Skin, we have with us Dr. Sunandita Sarangi. She is a skin specialist and cosmetologist practicing in Kolkata. Our topic of discussion today is how to get glowing skin and healthy hair in daily life. We will try to answer as many questions as possible after this session. Before we begin, I would request the doctor to share her views on the ongoing public health crisis.
Thank you, Navani. I must introduce my today's interviewer, my son, Sunandita Sarangi. Thank you, viewers. Hope all of you are very good condition. But before my session, I just want to share with you that you should follow WHO guideline properly. Number one is wash your hand with a gentle soap at least for 20 seconds or use any alcohol containing hand sanitizer. But after every wash, you should clean your hand properly and pat dry it properly and apply little bit of moisturizer. The second point is whenever you are going out, you try to cover your face with any mask. And most important point, stay home and as much as possible try to maintain a social distance. So Navani, today's topic is daily skin care. So I must say all of my viewers, you don't never underestimate your skin, because you know the skin is the largest organ of our body. As all of the time I suggest my patient that you know that skin is the reflection of our inner health. So if you have any problem, skin is working as a mirror. So you have to take care of your skin in a very simple way. It's not that you'll have to spend a lot of time for that, but the daily cleansing, moisturization, application of the sunscreen and night care regime. These three things if you follow in a daily basis, then and there only you can get a good healthy skin.
So doctor, you mentioned these cosmetic products, the cleansers, the moisturizers, the sunscreens. So on what criteria should I choose those or opt for those?
See, first we'll have to know what type of skin we have. Actually, generally we are dividing our skin in three general categories like oily skin, normal skin or dry skin. Normal skin, we are not prescribing such a specific kind of cleanser. You can use any kind of scented bar or any gentle face wash. But the person who has little bit of oily skin, they can go for some gel based cleanser, foaming cleanser, or these days some kind of salicylic acid containing cleansers are very good for acne prone oily skin. But somebody who has little bit of dry skin, or mostly the elderly people who has little bit of dry skin, they should use some milder variety of cleanser which is in a creamy form. But after every cleansing process, we must moisturize our face. Moisturizer actually rehydrate our skin. So after every wash, a oily skin should go for moisturizing lotion, and dry skin or sensitive skin can go for a creamy moisturizer. Along with moisturizer, another most important thing which we can't ignore in our daily basis, that is our sunscreen. It's a very myth that we are not going out, that's why you are not using sunscreen. Even if you are at home, we are using lot of laptops, computers, TV screen. Sometimes we are in a very hard kind of lights. So we need lot of sunscreen for the application during that period of time. Especially now when we are at home, we are spending most of the time in front of laptop. So we need a little bit of sunscreen in low SPF form like SPF 60 to 30 is enough. But some of my friends which are nowadays the media personalities, the journalists who are working in the field, now they need a high SPF sunscreen, at least minimum 40 to 60. And I must request to all of my those friends, you must wear a hat, try to wear a sunglass, and if possible cover your face. And a daily skin care, another very important point is our night care regime. Most of my patients who are under 28, I am not recommending a specific kind of night cream because I think a simple moisturizer is good enough for them. But if somebody is 20 plus, then we need a specific kind of night cream. The retinol, ferulic acid, these are excellent variety of anti-aging night cream. Some can use some kind of topical antioxidants like vitamin B12 or vitamin C, which are also working a very good night cream if you can apply in a daily basis. So our night care regime must be, one day we should apply an anti-aging cream, another day we can apply an antioxidant rich cream. So if we will follow these simple things in our daily life, in a long process, we can avoid a lot of skin problems.
Okay, so doctor, you mentioned that our inner health was a reflection on our skin. So how does our physical exercise help us in maintaining a good quality of skin?
Yeah, absolutely. I think that some external things are also important for our glowing skin, as well as some internal system is also making us look good. So there is we always say that there is a feel good therapy. If you do exercise in a daily basis, minimum 20 to 30 minutes in any form like yoga, swimming, walking, or gym, whatever you like, it's actually help us in a different way. When we do exercise, we get more oxygen, which actually very good for our tissues. And exercise also help us to stimulate lot of mood elevating hormones. And like exercise, we need also a very good healthy diet. It's not that all the time we need a very expensive healthy diet to make our skin glow. Our home cooked simple meal which contain everything like carbohydrate, protein, fat, vitamin, minerals in a proper portion, that is the best diet for our health as well as our skin. Like you know that carbohydrates are coming from our lots of grains. I always suggest you consume only your local food. And protein, we may consume a non-veg protein as well as a veg protein. Fat, we may get a good amount of fat from the dry fruits, from ghee, from some lot of oils. Fish oils, these are very good source of fat. All the green leafy vegetables, lots of fruits and vegetables can provide us lot of vitamins and the minerals. So if we can arrange our plate in this way, we can get everything which actually we need for our skin as well as our hair.
So going back a bit about the physical health, the exercise that you mentioned, is there a special protocol for swimming that we must follow?
Yeah, actually every summer season I'm getting lot of patients which are who love to do the swimming, but as they are getting tanned just after the swimming, they are not mostly interested for that swimming part. But if you can maintain some protocol before and after the swimming, you can avoid lot of these problems. Before swimming, we must apply broad spectrum sunscreen all of our exposed part. And just after swimming, we must take a bath with a proper cleanser, and then we should provide a good moisturizer throughout our body. Then you can see there may be 10% tan only because of the chlorinated water.
So just like our physical health which you mentioned, there is also our mental health which we must take into factor. Is stress a very important factor which decides the quality of skin or other skin problems we might face?
Yeah, stress is, you can't avoid stress. Stress is our now everyday's life. But if you follow a holistic living, if you follow simple general rule, we can avoid some stress. because you know that lot of skin problems which are arising due to stress, like exam stress can aggravate our acne problem, lot of stress can aggravate our itching problem, some kind of pigmentation like under eye dark circle, these are also very much stress related. So we are dividing the stress into different categories. Some is physiological, some is pathological. The physiological we can reduce with proper exercise, some kind of positive thinking, good book reading, and proper sleep also. So as much as possible, try to stay stress free if you want to get a good skin.
Ma'am, we face a lot of different diseases such as pigmentation, acne. So these are very common skin problems. What is your solution for these?
See, it is better if you have this kind of problem or any problem, when it appears fast, you must consult with your skin specialist. You should not do any experiment of your own, because nowadays it is very common that first lots of my patients are trying so many medicines on their skin. When that is not working, then and there they are coming to us. So you should not do that. You must go to your doctor. According to your doctor's advice, you follow their guideline. I think all problem can be solved if you follow it in a proper way. You will get lot of treatments in our clinic nowadays. If somebody is coming with acne, they also develop some acne scar, acne pigmentation. So we are always suggesting, it's not the medical guideline to treat the acne. It's also, I always advise my patient to treat the acne scar as well as the pigmentation along with the acne treatment. So nowadays lot of procedures, lot of treatments are available to get rid of all these problems.
Ma'am, a very popular part of Indian medication is kitchen medication. So what is your thought on those?
Yeah, kitchen medicines are really popular from ancient time. We can't ignore those. Even nowadays, the kind of peeling agents we are using in our chamber, those are also coming from lots of kitchen ingredients also. But you know one thing, that anything which is raw, it's not good for our skin. We have to make it skin friendly. Then and there only we can apply it. But if somebody is really interested to apply some raw ingredient for their skin, I always suggest you do some patch test or apply little bit of that ingredient on any part of the skin. If there is no redness, no irritation, then they can go ahead. But my suggestion, any problem, you must consult with your doctor.
Doctor, there are specific types of patient or say person who have some occasion to attend in say 2 weeks or a month, let it be a wedding occasion or some meeting or some conference which is coming up. So they want to rejuvenate their skin in a very short period of time. So what is the suggestion based on that?
Yeah, that is a very interesting question. Rejuvenation of skin. Nowadays it is boom. Everybody is coming and want to get, ma'am, I'm getting married within 2 months, and maybe that time she has lot of pigmentation, lot of acne scar, but they want to get a fully glowing skin. Nowadays it is possible because now we can use lot of cosmeceuticals products. Now we can do lot of procedures like chemical peeling, microdermabrasion, derma roller, some kind of laser treatments, and they are actually help us to give that confidence to my all patients that yeah, I can make you ready within 2 months. Actually, I can help you that you can get a glowing skin on your that specific day.
Okay, so we will move to the next part of a discussion, which is regarding hair. Ma'am, can you suggest a regular, let's say, regime or a routine to take care of our hair and make it healthy?
Yeah. Hair is also a very important part of our body. You know that hair is totally a protein structure. Top to bottom, hair is a keratin protein. But nowadays we are doing so much experiment with our hair. We are changing our style so frequently. That's why maybe we are losing our hairs. In daily regime, if you our only purpose to keep clean our scalp. So if we can use a shampoo, mostly it is preferably it must be a sulfate free shampoo if it is possible, then we can get a good healthy hair. If we do it in an alternate day, if you can use it alternate day, if somebody is working out, they can use it every day. Clean scalp is the first thing of a healthy hair. But if somebody is having some kind of dry or itchy scalp, they can go ahead shampooing once or twice in a week. But shampooing is very much important to get a good hair.
A very common problem or complaint of patients is that they are losing hair a lot. So what is your view on that?
As I said that we are doing a lot of experiment, because very frequently we are changing our hair color. Sometimes we are doing hair straightening treatment, sometimes we want the palming treatment, lots of using of the blow dryer. These are actually these has lots of adverse effects on our hair health. So you can go ahead with all these stylish procedure, but one thing you have to maintain it in a proper way. Means all this specially treated hair, we need deep conditioning treatment, popularly known as spa treatment. And nowadays in the market we are getting a lot of good serum also, which is also a kind of conditioner. Means after every shampooing we need to use a conditioner. And thing is that conditioner you should not apply on your scalp, you always apply it on your shaft of the hair. But conditioner we are washing out after keeping it just for 5 minutes. But serum is a conditioner which we can keep whole day. So if somebody is suffering from frizzy hair, they can go ahead for serum conditioner. But if you have a lot of hair fall problem, every day we are losing some amount of hair, which is actually common, because those are all our dead hair. But if you think it's not your physiological, it's something is there, problem is there, then you should go to your doctor, because some of our inner problems reflecting in such a way, the symptom is a hair fall, like hypothyroidism. In hypothyroidism we are losing a lot of hair. There is another gynecological problem which is popularly known as PCOD, polycystic ovarian disease syndrome. In this condition also we are losing a lot of scalp hair, but our facial hair is growing. So in this condition you should go to your doctor. Don't apply any medicine which actually leveling as a hair growth medicine.
Ma'am, right now we are seeing a lot of premature graying of hair in various age groups also. So what is your view on that?
The thing is that same thing that 18, 20 years of age, the people are coming to us, they are suffering from early baldness, early premature graying. Specifically we don't know why. Maybe the environmental pollution, maybe due to stress, and maybe the smoking, these are the key factors. But there is not such kind of medicine which can help to stop the graying of the hair. Sometimes it is hereditary, but what we can suggest to my patient, they can they can camouflage that graying of the hair. Nowadays you will get lot of good hair color in the market which are actually dermatologically tested. Basically they are PPD free and which are really skin friendly. So anybody can go ahead for all these hair colors. But one thing you should keep it in your mind, that we should not do the hair color. We must do the hair color at least 6 weeks interval. We don't do it very frequently. As I have an occasion, that's why I have to camouflage my gray hair. So I used to do it in every day. You should not do that. You maintain a proper cap. And if you are a very frequent user of hair color, you must deep condition your hair, which is also very important, because hair color is also a cause of dryness of hair.
Just as before, ma'am, I would like to ask a question. What type of diet is suitable to maintain a healthy hair?
The same thing, what I have advised you, the skin diet, that is all good for hair. Only thing is that for our hair growth, we need to two very important things. One is protein, another is biotin. Protein is very important for anything, which also gives us lots of immunity. Protein also helps us to helping in growth of the hair. But as well as biotin, we may not get it in the food, but nowadays lot of capsules you will get in the market which contain biotin. But I always suggest never consume any capsules of your own. If your doctor will advise you, then and there only you can take. Even some kind of antioxidants actually which are very good for our skin also. As I have mentioned that these dark leafy vegetables, our fruits, these are very rich source of antioxidants. Now you know a little bit about the antioxidants, why we consume little bit of antioxidant in daily life, because every day due to pollution, due to stress, we are generating lot of toxins in our body. So these antioxidants helping us to detoxify all these toxins. So that's why we need to consume little bit of antioxidants, little bit of biotin containing capsules in our daily food regime.
Ma'am, is there any relation between stress and hair fall?
Absolutely. If you can see an examinee who is also in a very stressful condition, most of the time they are suffering from acne as well as hair loss. But that time we always suggest them, please don't do any treatment, because some of the skin diseases you have to, skin diseases don't need any treatment. You have to keep patience. You need for some time, because our body has a self immunity system which can heal their own problem. So as much as you avoid self medication, as if you are facing any problem, don't get worried, oh my god, I have a acne on my skin, what should I do, I'm not looking good. You just keep patience, because these are all normal phenomena. You wait for few days. If it is not solving, you go to a doctor. And as a doctor, I always advise all of my viewers, these days self-medication is a big problem. So never do that, because most of the counter medicines are containing steroid, and you don't know which skin disease we need steroid. Some of the skin diseases, if we apply the steroid cream, it actually aggravates that problem. Some are the fungal infection, some are the acne problem. It may reduce for the time being if you apply a steroid containing cream, but later on it will aggravate. So better you avoid self-medication. If you are facing any problem, you go to a doctor. But every day, if you spend just 5 minutes in the morning and 5 minutes in the evening and maintain this cleansing, moisturizing and night care regime, as a doctor, I must say, at least you can avoid to develop lot of skin diseases and you will get a very good skin. But if you need more than that, then you can go ahead for lot of treatments are there. But don't do any self-medication for your skin as well as for your hair.
We face several hair-related problems in daily life, such as dandruff, itchy scalp. What is your recommendation for these problems?
See, dandruff is a very common problem of the adolescent age group. And summer season, monsoon season, as we are not cleaning our scalp properly, it is very common for all age group. The first thing, if you are having dandruff, that doesn't mean you have a dry scalp. Most of the time, most of the people are thinking we need to apply lot of oil. So it's a very common myth. You should not apply any oil if you are having dandruff. Your job is just keep clean your scalp. Either you can use anti-dandruff shampoo or you can use your normal shampoo. But if you are using your anti-dandruff shampoo, you do it every alternate day, but you don't use it entire length of your hair. You have to put it only on the scalp of your hair. You apply that shampoo, keep it for 5 minutes and then you wash it. and do it every alternate day, minimum for 1 month, maximum for 2 months. It's not advisable to continue it for a long time, because every anti-dandruff shampoo contains some kind of medicine, and we all know these are all medicines. They also have good effect, as well as if we are not using in a proper way, they also have very bad effect. So if you are using it for more than 1 month or 2 months, after that you can continue to as your normal shampoo for a daily basis. And for dry scalp, dry itchy scalp, mostly it is developing due to lot of chemical treatment. So, or if you are allergic to any hair dye, so that time also you have to think about what are the foreign ingredient which is actually making your scalp skin more sensitive. If you are feeling any itching after application of any this kind of things, any oil, any hair color, or any styling agents, you should stop it, and then you consult with your doctor.
Thank you, doctor. Is there anything else that you wish to add?
At last, I must request to all of my viewers, this is a very crucial period of time that all of us are going through. But we must respect to all of our frontline soldiers, who are our doctors, who are our nurses, our health workers, most important person, the broadcasting persons, the media persons. We should pay proper respect to them, because every day they are working a lot to win this battle. And this is all. I think if you can follow all these things in everyday life, you may not face lot of problem, and if you need any help from us, we are always ready to help all of you, and I try to give answer to all of your questions as much as possible. But later on, if you have any queries, you can send your queries in this mail ID. Thank you, viewers. Thank you so much.
Okay, so our viewers have some questions, such as Rubidas had a question which was, which oil is good for hair growth?
No, my suggestion, no oiling of your hair, because our scalp contain lot of oil glands, they are actually produce lot of oil in your scalp. But yeah, we have some conception, if we are not oiling our hair, we'll face lot of hair fall. Then what you can do, just before shampooing, you can use little bit of oil on the shaft of your hair, and I think coconut oil is the best thing.
The next question that we had is, what is the best cream to treat mosquito bites?
Yeah, it's a very important question, especially this period of time. What's the name of the viewer?
Pranjali Moore.
Pranjali, thank you. It's a very important question. Not the mosquito, that especially the monsoon, we are facing lot of insect bite problem. So for that this period of time, if somebody facing this problem, then it is better to use a simple calamine lotion or a coconut oil, which is actually working as an antipruritic agent. But later on, when doctors are available, then you can go ahead. There are a lot of good creams, antibacterial, antibiotic cream, which we need to apply for that specific part. We may consume some kind of antihistaminic also, but you should not do it of your own. For the time being, if you are facing this problem, you can go ahead for the calamine or the coconut oil.
I did not record the name of the person, but there was a question related to PCOS related acne.
Absolutely. PCOS is a very common problem nowadays, but mostly happening at the age of 18. We are getting some of the patients who are aging 25 to 26 also. PCOS has different kind of features. They are losing their hair, they have lots of weight gain, they have lots of acne, and some kind of body hair growth as well as facial hair growth. But as we can't treat the PCOS, I am always advising to do some of the tests, some of the USG, And when we saw the report that that patient is suffering from Pcos, I always advise to go to an endocrinologist or a gynecologist. And if they are interested to remove their facial hair, then we are suggesting to remove the hair with the help of the hair removal laser. One thing I must say, this is a very important thing. If you are suffering from this problem, you have lots of facial hair, please don't do wax or don't thread, because after using all these procedures you may face lot of problems. So the best treatment to remove your facial hair is the hair removal laser or the IPL treatment.
The next question we had was, is there any home remedy for hair keratin? Like,
Keratin is a protein, so any protein, if you want to apply, you can apply, like curd, egg, these are all kind of protein. But my suggestion that you better to have it rather than applying it. So if for your satisfaction, you can use it on the shaft of their hair, not on the scalp. Don't do any experiment with your scalp of the hair, because this is your dead part. But if you do experiment with your scalp, you may develop a dry itchy scalp.
There was a question about how should one deal with the itchy scalp.
Yeah, itchy scalp, you have to first know that what are the causes of itchy scalp. I have already mentioned that all these blow dryer, these hair straightening treatment, the hot ironing, they may cause the itchy scalp. Sometimes the fungal infection, which is actually the dandruff, they also can cause a itchy scalp. So whenever it is developing, if it is a huge amount of itchy scalp and lot of flaking scalp, you can go for the treatment. Doctor will suggest you some of the steroid lotion along with the antifungal lotion, which will help you a lot. But if you are suffering from this kind of itchy scalp and you need a home remedy, I will suggest you clean your scalp with a gentle shampoo.
The next question we had was regarding how should one deal with skin allergies.
See, first thing, skin allergy is not a single term. It's a broad spectrum term of skin allergy. One may develop allergy due to some external cause, one may cause allergy due to some internal cause. But and there are different kind of symptoms of a skin allergy. But if you are suffering from a specific kind of allergy, which is popularly known as urticarial problem, if somebody has a small bump, red-like bump on their skin, and they are suffering for more than 4 to 6 weeks, then we popularly known as a chronic urticarial problem. Then we must go ahead for some blood test or some hormonal test, and then we are suggesting some kind of antihistaminics and some topical calamine lotion. But all these things is not a induced medication, means you can't treat it at your home. If you are suffering from any kind of allergic problem, you should consult with your doctor, because you don't know what is the cause. But you should take care. If you are ignoring this kind of allergy for a long time, you may suffer from a severe acute problem. So it is better, whenever you are facing this kind of allergic problem, you go to a doctor.
The next question we had was, is there any specific skin regime for diabetic patients?
Skin, yeah, diabetic patient skin is very sensitive skin. So if there is any kind of bacterial infection or the fungal infection, we should take care of those infections as early as possible. And because they need proper skin care treatment, because their skin is very much prone to develop all these kind of infections.
The next question we had is how to reduce dark circles.
Yeah, as I mentioned now, stress is also a cause of dark circle. Sometimes anemia is a cause of a dark circle. Sometimes if we have any kind of allergy, we are rubbing our eyes for a longer time, it may cause the dark circle. And another is the sleep. These days vitamin C, vitamin K, they are working very good for removing these dark circles. And there are a lot of medicines also which are actually help to reduce this kind of dark circles.
The next question we had is that does anti-aging cream work, or do you need a serum or some laser procedure for it?
Yeah, absolutely. As I mentioned that whenever you are going, if you are age 28 plus, then that is the prime time to start your anti-aging treatment. It doesn't mean that when I have developed some wrinkles, I will start my anti-aging treatment. You should not do in that way. Then you don't need any kind of aggressive treatment in an early stage. So we can, it's not that we can stop aging, but we can prevent lot of problems. Like if you are facing, there are a lot of signs of aging signs, you know, some of the freckles, some are a little bit of pigmentation, the dullness of the skin, little bit of the fine dry lines. That's why when we are facing this kind of problem, we must start some kind of anti-aging cream in our daily schedule. And along with this cream, we can go ahead for the peeling treatment, which is excellent treatment nowadays. We can go ahead for the microdermabrasion, which is a very good treatment for our wrinkles. And later on, if it is in a very advanced stage, we can go ahead for the laser treatment also.
The last question that we had was black marks or blackening of skin near neck folds, what to do regarding that?
Yeah, that is also a very common issue for the obese people. It is known as acanthosis nigricans. But you don't think that this is a pigmentation. This is a very deep rooted problem. We have lot of medicines for that. But one thing you should not do, you don't rub your skin vigorously. Any rubbing of the skin can increase the pigmentation. So if you are facing any kind of pigmentation on your skin part, you never rub your pigmentation. You can apply your coconut oil, you can apply a little bit of aloe vera, and then you go for a specific medication, and you can try to lose little bit of weight. Then you can see it may reduce, at least 50% can be reduced with the weight reduction.
There is one more question that baby skin is very sensitive and most of the babies have often dry skin. Tell us about the routine skincare for babies.
Yeah, we all know that baby skin are actually sensitive, and it's not that you have to take care of your baby skin in a very formal way. It's just a simple way, everyday bath. And nowadays all our doctors are suggesting don't oil your baby, because oiling actually nowadays we are always advising don't put any oil on your baby skin part. If you want to put oil, you put it on the bathing water. What you can do, every day you use a gentle soap or gentle cleanser, which is actually you will get any means a pharmaceutical product. It's not any, or you can use a scented bath to clean your baby skin surface. And just after the bathing, you apply generous amount of moisturizer. And another thing, that when the summer season, we used to use lot of powder. We are dusting powder a lot. You should not use in that way. You dust your powder on your palm, then you nicely rub it on your palm and just apply it on your surface. And another thing I should mention, viewers, whatever you will apply on your skin, you never apply it on direct on your skin. Everything you take it on your palm first, rub it on your palm gently, then gentle pat dry it on your skin. Never massage vigorously anything on your skin.
Next question we had was what is the best sunscreen for sensitive skin?
Best sunscreen, yeah. Sensitive skin, you can go ahead for gel-based sunscreen these days, or a physical sunscreen, which is actually contains zinc oxide or the titanium dioxide, which is good.
I think, doctor, while using shampoo, does pH play an essential role?
Yeah, that is also very important, but I always suggest as much as possible you try to use a sulfate-free shampoo.